Okay, good evening. So, our next topic, is about blood physiology. So, this is the first part of the circulatory system. So, let us start our discussion. Okay, so what are the functions of our blood? So, you have number one, it transport gases, nutrients, and waste products. During our discussion of our circulatory system, or rather of our respiratory system, we have discussed how oxygen and carbon dioxide are transported through our blood, specifically by our red blood cells. Aside from the gases, our blood also transports nutrients and waste products. It also transports processed molecules, transport of regulatory molecules, regulation of the pH of the body, and osmosis, maintenance of body temperature, protection against foreign substances, and lastly, clot formation. So we will be discussing the details of some of those functions for this session. Okay. Now, the blood is composed mainly of two components, and that is yung plasma and the formed elements. So as you can see, no, when blood is subjected into a centrifuge, okay, pagka yung blood natin is subjected into a centrifuge, you can actually separate the liquid portion and the formed elements of the blood. And as you can see, no, the liquid portion is called plasma and it accounts for 55% of our blood volume, while the formed elements is 45%. Okay? So, yung plasma, the liquid portion of the blood, is a pale yellow liquid, no, that surrounds the cell. Ah, it is made up mainly of water. 91% of our plasma is water. Okay? 7% are the plasma proteins, while 2% accounts for the other solutes. Now, what are those plasma proteins? Okay? Sige, babalikan natin yung plasma proteins na yan. Doon muna tayo sa formed elements. No? So the formed elements, again, 45%, no, is composed of cells and other cell fragments. Okay, so what are those formed elements? Erythrocytes or the red blood cells. Okay, you have your wait lang, you have your leukocytes or the white blood cells, and then your thrombocytes or the platelets. Okay, so the formed the plasma proteins, as I have said earlier, uh, is composed of albumin, globulin, and fibrinogen. And as you can see, uh, by percentage, the highest is your albumin. It accounts for 58% of your plasma proteins. And one of the main functions of your albumin is to maintain the water balance in our circulation. In fact, it is albumin that maintains our plasma osmotic pressure. Oh, that's the reason why our plasma can actually hold back water. It's because of the presence of albumin. Now, globulins naman, which accounts for 38% of plasma protein, is important for our immune system. No? In fact, ah, uh, globulins are actually immunoglobulins. And pagdating natin uh, sa immunity, no, specifically doon sa uh, anong tawag dito? Lymphatic system. Yan. We will be discussing the different types of immunoglobulins. Ah, and the smallest percentage is uh, by your fibrinogen. It accounts for 4% of all of your plasma proteins, and its main function is to aid in clot formation. Okay? Now, you also see in this picture that in all of those formed elements of the blood, no? Okay, the most numerous are your red blood cells. So, for those who have an idea already, no, regarding a CBC or complete blood count, di ba? So, when a blood sample is drawn, no, from your vein, just like what you see in the picture, no? So, sa laboratory, a complete blood count, no, may be done, no? And usually when you say complete blood count, no, the number of formed elements per cubic millimeter of blood, no, is usually measured. So as you can see, a normal count, no, kapag ka red blood cells, it accounts for 4.2 to 6.2 million of red blood cells per cubic millimeter of blood, while your white blood cells, no, accounts for 5 to 10,000 only per cubic millimeter. And your platelets accounts for 250 to 400,000 per cubic millimeter. So ang pagkakasunod-sunod mula dun sa pinakamarami hanggang sa pinakakonti, red blood cells, platelets, and white blood cells. Okay? So we will be discussing, no, the details of each component, no, or formed element of the blood later. Now, as you can see, we have 5 types, no, of white blood cells. Okay, that is why each in a complete blood count, no, in a complete blood count, yung mga white blood cells na yan are also counted in terms of their percentage, of the total white blood cell count. And as you can see, by percentage, ang pinakamarami is your neutrophils, no? Followed by your lymphocytes, followed by monocytes, followed by eosinophils, and lastly your basophils. Again, the most numerous of, of your white blood cells or your leukocytes are the neutrophils. Let's continue. Okay, now hematopoiesis, no? The word hematopoiesis is the process of production of formed elements in the blood. Okay. Now, in the fetus, hematopoiesis occurs in several tissues, including the liver, thymus, the spleen, the lymph nodes, and the red bone marrow. So in the fetus, these are all hematopoietic tissues, meaning these are all capable of producing the formed elements of the blood. Again, the liver, the thymus, the spleen, the lymph nodes, and the red bone marrow. But after birth, okay, hematopoiesis is exclusively a function of your red bone marrow, just your red bone marrow. Okay? But there are some white blood cells that are also produced in our lymphatic tissues. But again, majority of the formed elements of the blood, no, takes place, or production of majority of the formed elements of the blood takes place in our red bone marrow. And that process, again, is called hematopoiesis. Okay? So, all of those formed elements of the blood are derived, no, from a single population of cells called stem cells. Tawag doon sa mga generic population of cells that are produced in our red bone marrow are called stem cells, also known as hemocytoblasts. Okay? The stem cells specific to our blood, no, are called hemocytoblasts. And these stem cells, no, undergo the process of differentiation in order to give rise to different cell lines. Kasi nga, di ba? We have different types of formed elements in the blood. You have your red blood cells, white blood cells, platelets, lahat dito galing sa stem cells yan or the hemocytoblasts. They just undergo differentiation again to give rise to the different cell lines, each of which ends with the formation of a particular type of a formed element. Okay, so this is what I'm telling you about. No? So this is your hemocytoblasts or your stem cells that is found, no, in your uh, red bone marrow, no? O, also known as your hematopoietic, no, stem cell. So as you can see, hematopoietic stem cell during the first stage of its differentiation differentiates into a myeloid stem cell and a lymphoid stem cell. Ah, myeloid stem cells differentiate further into, ayan, your red blood cells, your megakaryocytes, and also dun sa first four types of white blood cells or your leukocytes. So ulitin ko, from your myeloid stem cells, ha, that is where a mature red blood cell will develop. That is where a megakaryocyte will develop, no? And when a megakaryocyte fragments into smaller pieces, then it becomes your platelets. So therefore, platelets are no longer considered cells because these are just cell fragments of our megakaryocytes. Okay? And as I have said earlier, myeloid stem cells also differentiate into the first four types of your white blood cells. What are those? Your neutrophils, your eosinophils, your basophils, and your monocyte. Only one type of white blood cell develop from a lymphoid stem cell, which is your lymphocyte. Okay? No? That is why, di ba, if you will look up, no, if you will search, no, for the two types of leukemia, di ba? Yung leukemia is cancer of the blood. Ah, oh. Uh, you have two types, no, of leukemia, no? You have your lymphocytic leukemia at saka yung myelocytic leukemia, depending on the type of cell, no, that is primarily affected. If the cell primarily affected, no, are those that come from the lymphoid stem cell, it's called the lymphocytic anemia, leukemia. If the cell that is affected that are those that originate from your myeloid stem cell, then that is called myelocytic or myeloid, no, type of leukemia. Okay? Sige. So take note of this figure, no? So that you can easily remember, no, how the formed elements of our blood are produced. Again, during the process of hematopoiesis. And again, this takes place primarily where? In our red bone marrow. After birth. Again, before birth, in the fetus, saan-saan nangyayari ang hematopoiesis o liver, thymus, spleen, lymph nodes, and the red bone marrow. Let us continue. Okay, so let us look at the characteristics, the structure of each of those formed elements of the blood. First, starting with your erythrocytes or your red blood cells. Red blood cells are disc-shaped, no, with thick edges. So as you can see, no, if you will have a cross-section of our red blood cells, no, it is disc-shaped, but the edges are thicker, no, as compared to the center. Ah? And our red blood cells, no, does not have any nucleus because during development, no, the nucleus is extruded. It is lost during development. And the normal lifespan of our red blood cell, no, is that it is only about it stays only in the circulation for 120 days. So that is about how many months, no? In 120 days na yon. Around uh, uh, 4 months, no? Around 4 months. Okay? So, uh, so therefore, no, there should be continuous, no, production of uh, red blood cells in the red bone marrow. Kasi nga, 120 days lang. So, after 120 days, those old red blood cells, no, will undergo hemolysis, ah, and will be deposited in our spleen, because the spleen is the graveyard for our red blood cells. And as we have seen in our discussion of the respiratory system, nakita naman natin that the function of our red blood cells is primarily to transport oxygen into the tissues. Okay? No. So, ang red blood cells natin, since this is this shape, no, with thick edges, it makes the red blood cell very, very flexible so that the red blood cell is able to fold so that it can fit in even to the smallest and tiniest capillaries of the body. Okay. Now, there is one type of anemia, no, that can affect the flexibility of your red blood cells, and that is called your sickle cell anemia. Again, sickle cell anemia. In sickle cell anemia, the red blood cells become sickle-shaped, resulting to its uh, losing its flexibility. No? So ang nangyayari, hindi siya makafit ngayon dun sa mga uh, tiny blood vessels, tiny capillaries. No? In fact, bumabara pa nga sila dun sa mga tiny capillaries na yan. Okay? So let us continue. So one important component of our erythrocytes or red blood cells is your hemoglobin. And we have seen in our discussion of the respiratory system that it is the hemoglobin that transports oxygen primarily. Huh? Oh, okay. So it is composed of a heme molecule, no, wherein a globin protein is attached, no, to your heme molecule. And heme is primarily composed of uh, an iron atom, no? Oh, okay? Kaya nga in order, no, for hemoglobin to develop, you need atoms, no, of iron. That is why iron deficiency in the body actually leads to deficiency of hemoglobin. That is why we have what we call iron deficiency anemia. No, wherein you have normal red blood cell count, but inside your red blood cells, you have deficiency of hemoglobin. O ang tawag doon, iron deficiency anemia. No? So once oxygen binds to iron already, no? O in the hemoglobin, no? So dumikit pumasok na yung oxygen dun sa hemoglobin, it is now called oxyhemoglobin. And um, up to 4 molecules, no, of oxygen can bind to hemoglobin because, as you can see, no, it has 4 heme components. No? Each hemoglobin molecule has 4 heme components. So, hanggang 4 na oxygen talaga yung pwedeng mag-bind sa kanya. So let us continue. So as we have said earlier, no, red blood cells, no, just like any formed elements of the blood, no, are produced in our red bone marrow, no, through what stem cell population? Your myeloid stem cells, di ba? Now, there is one important factor, no, that affects the production of red blood cells in our bone marrow, and that is primarily the oxygen levels in our blood. When there is decreased blood oxygen levels in our blood, it causes the kidneys to produce the hormone erythropoietin. No? When our kidneys detect that the oxygen level is decreased significantly, the kidneys will increase the production of this hormone. Again, this is called erythropoietin. As you can see here in the illustration, uh, decreased blood oxygen na-detect ng kidney, then it increases the production of erythropoietin. Erythropoietin targets your red bone marrow. Then the red bone marrow primarily increases red blood cell production. Okay? So as a result, no, it will result to a higher blood oxygen level because it is our red blood cells that contains the hemoglobin that transports primarily oxygen. So ang resulta, tataas talaga yung oxygen level. So remember that hormone, erythropoietin. So as you can see, no, patients with renal failure, no, ibig sabihin kapag ka pala ang pasyente may renal failure, ah, the red blood cell production can be severely affected also because of the decreased production or pwede nga, no, as in zero production. Kung talagang both kidneys, no, have zero function, there will be zero production of erythropoietin which will result to a decreased red blood cell production. Kaya ang mga may renal failure really will suffer from anemia. No? Kasi talagang bagsak ang kanilang red blood cell count. Let us continue. Okay. So, uh, as we have said or as I have said earlier, no, ang red blood cells after it is produced in the red bone marrow stays only in the circulation for 120 days. No? So after 120 days, they are removed from our blood by macrophages in the spleen and in the liver. No? But primarily, it is deposited in the spleen. As I have said earlier, it is the graveyard for your red blood cells. Hemoglobin is broken down. No? Okay? Yung globin is broken down into amino acid. Oh, okay? While yung hemoglobin's iron, no, yung heme component is recycled. Oh, paano nire-recycle yung heme? The heme is converted into bilirubin. Oh, yung heme again is converted into bilirubin. While bilirubin is taken up by the liver and released into the small intestine as part of bile. Diba? Sabi natin sa digestive system, no, the main function of our liver is to synthesize bile. And our liver primarily use bilirubin, no, from uh, the uh, recycled heme, no, ng hemoglobin, no, coming from the blood. Ginagamit niya yung bilirubin na yun, ginagamit ng ating kidneys for the production and synthesis of bile. Okay? No? Now, that is the reason why uh, when you have a liver problem, no? Yun sa mga may hepatitis, severe hepatitis, may mga liver cirrhosis, wherein the liver can no longer process bilirubin, bilirubin stays in the circulation. It accumulates in the circulation. And it is the pigment that actually causes, no, the yellow discoloration of people with severe liver disease. Kaya naninilaw ang mga may liver problem. It's because of the accumulation of bilirubin in the circulation. Ah, it cannot enter the liver, no, for processing. Okay? So, yun, no, yung nangyayari sa ating erythrocytes and hemoglobin after 120 days. Let's continue. So, well, we have just finished our erythrocytes or our red blood cells. Now, let us go to leukocytes or white blood cells. They are actually white, no? Because they do not possess hemoglobin. It is actually the hemoglobin, no, that is responsible for the red pigment, no, or the red color of our red blood cells. So since white blood cells do not have hemoglobin, yung, hindi sila red, di ba? They are actually larger than erythrocytes, and unlike your red blood cells, they contain nucleus. Huh? And there are two primary functions of leukocytes: fight sa infections and to remove dead cells and debris in our body by phagocytosis. That is why, no, in cases of systemic infections, when you undergo complete blood count, no, most of the time there is an elevated white blood cell count, no? O it's a sign, no, of infection kapag ka elevated ang white blood cell count mo. Ha? Okay. So what are the different types, no, of your leukocytes or white blood cells? It can be classified as granulocytes and agranulocytes, no? Granulocytes, yun yung appearance nila, granulocytes and agranulocytes is based on their appearance under the microscope. Pag sinilip under the microscope, granulocytes contain specific granules, no, on their cytoplasm, while agranulocytes, they have no granules in their cytoplasm. So what are your granulocytes? Your neutrophils, eosinophils, and basophils. And as we have said earlier, the most common type of white blood cells, the most numerous, uh, is your neutrophils. That is why it is considered as the first line of defense against infection. Kasi siya yung unang lumalaban talaga sa infection. No? And it remains in the blood, no, for 10 to 12 hours. And then they tend to move to our tissues, especially if there is really an infection. Because the main function of your neutrophils is to phagocytose, no? Or alam niyo na naman ang process ng phagocytosis. Yan, no? Cell eating, di ba? O, your neutrophils perform phagocytosis. To eat cellular debris, no, to fight against infection. So therefore, sila yung kumakain ng bacteria, no, and other foreign substances, no, or materials, no, na nakapasok sa ating katawan. Second, you have your eosinophils. Eosinophils naman, no, functions primarily to reduce inflammation, no? And also, eosinophils, no, functions to fight against parasitic infection. Parasites, such as worm, no? Oh, yung mga intestinal worm na yan. Oh, that is why, no, when a child, no, is infested with intestinal worm, the differential count of eosinophils might increase also because it is the white blood cell, no, that functions to fight against parasites. While the least common, no, of all, as we have said, no, in our introduction earlier, of all of those leukocytes is your basophils. Yan ang pinakakonte. And its main function is to release histamine and heparin. And that is the reason why ito yung responsible, no, for mediating allergic reactions. That is why, no, when you are undergoing allergic reaction and a complete blood count is conducted, you will notice that the differential count of basophils, no, will increase. Oh, kasi yan yung nagre-release ng histamine during an allergic reaction. And histamine is one of the mediators, no, of inflammation and also allergic reaction, no? Kaya yung redness, no? Tsaka yung pruritus, no? Yung pangangati. Kapag may allergic reaction ka, ang responsible dyan is yung histamine. That is why, no, the primary medication for the management of allergic reaction is to give antihistamine. No, because again, histamine is responsible for those signs and symptoms. Now, let us go to the agranulocytes. And as I have said earlier, agranulocytes do not have molecules or granules in their cytoplasm. So you have two types, no? Your monocytes and your lymphocytes. The monocytes are the largest of the white blood cells, and they are the ones that produce macrophages. Sa kanila nang gagaling yung macrophages. Ah, okay? While ito namang lymphocytes, no, is responsible for the immune response. And we have two types, no, of lymphocytes, no, depending on where, no, in our system, no, uh, it is derived, no? Yung T lymphocytes is derived from a lymphatic tissue, specifically the thymus gland, while the B cells, no, is derived from our bone marrow, specifically from our red bone marrow. Huh? Oh, they are actually the one that produce, no, our antibodies. So therefore, they are actually responsible for immune response talaga kasi antibodies eh. Di ba? No? So, diyan nanggaling ang ating T cells and your B cells. No? Sige. Let's continue. So this is uh, what they look like, no, under the microscope. Okay, sige. Now, the last cell, or rather formed element, no, in our blood, no, are the platelets. And as I have said earlier, no, platelets are no longer cells, but they are minute fragments, no, of our megakaryocytes, no, each consisting of small amount of cytoplasm surrounded by the cell membrane. Again, they are derived from the megakaryocytes. These small fragments break off from the megakaryocytes and enter the blood as our platelets. And as you know, platelets play an important role in preventing blood loss. No? Oh, it actually prevents bleeding. That is why a decrease in platelet count, no, which happens, no, when someone um, suffers from dengue hemorrhagic fever, yun, when platelet count decreases, nagkakaroon ng internal bleeding, no, yung pasyente, no, which is, no, actually a life-threatening condition. Kaya nakakamatay ang dengue because of that. Ha? So, when blood vessels are damaged, blood can leak into the other tissues and disrupt the normal function. No? Blood that is lost must be replaced by production of new blood or by transfusion. Okay? So there are three ways by which our body, no, prevents blood loss. First is vascular spasm, wherein you have temporary constriction of blood vessel. Kaya lang, temporary lang yun. So therefore, after your vascular spasm, the other two mechanisms must come into action. And that is yung second, o yung platelet plugs. Platelet plugs is formed by aggregation of the platelets, which can seal up small damages in our blood vessels. Now, kapag malalaki yung damage, then you need blood clotting or yung tinatawag na coagulation, no? Blood clotting or coagulation. So these are the three, no, mechanisms by which blood loss, no, is prevented. Okay na tayo dyan sa vascular spasm, no? Na-explain ko na, which is just temporary. In a platelet plug formation, no? Kapag ka platelet plug formation, this is how, no, platelet plug formation takes place. Ha? Okay. In this drawing, you will see, no, a blood vessel wall which is made up primarily of smooth muscle layer, no, a collagen layer, and an endothelial cell which is made up of simple squamous epithelium. No. When a blood vessel is damaged, as you can see, there will be exposure of the smooth muscle and collagen. There will be smooth muscle production. There will be exposure of smooth muscle, and the collagen. When the collagen is exposed, because of that damage, no, the first step will be adhesion of the platelets to collagen, no, via the activation of a factor called the von Willebrand factor. O kapag dumikit, no, ang red blood cells, kapag dumikit, ang platelets doon, no, nag-adhere on the surface of a damaged blood vessel wall, no, it will undergo uh, a series of cascading events. So, yung platelet adhesion, no, will be followed by platelet release reaction, no? So, it will undergo several changes, no, that will make it spiny and sticky. Kaya dahil nga naging sticky siya, there is this tendency for platelets now to aggregate, no? O mag-aggregate sila in order to form a plug into that damaged blood vessel. Okay? So therefore, bleeding will be prevented, no? So, so as you can see, no? This is what I told you about earlier, no? So the first step is platelet adhesion, no? When platelets stick to the exposed collagen in the damaged, no, blood vessel, it sticks because of what? Because of the von Willebrand factor. Now, after platelets adhere to collagen, they become activated, change in shape, and release some chemicals. No? Okay? Hanggang paulit-ulit na mangyayari yun. In platelet aggregation, fibrinogen forms bridges between the fibrinogen receptors of numerous platelets, resulting into a platelet plug. Because of that fibrinogen, yan, kita mo, platelets are able to stick to each other, forming platelet plugs. Okay? Now, what about blood clot? No? So blood clotting, no, is when blood is transformed from liquid to a gel. No? So clot is a network of thread. So during clot formation, a network of thread-like proteins, yung tinatawag nating fibrin, that trap blood cells and fluids. No? So the clot formation depends on clotting factors in our blood. Ano ba yung clotting factors? Clotting factors are proteins present in our plasma. And usually clotting factors are activated only, no, after an injury, especially if there is, no, a major injury to our blood vessel that leads to bleeding. And those clotting factors, no, are synthesized in the liver. Okay? And most of those clotting factors require the presence of vitamin K in order to be synthesized in the liver. That is why vitamin K deficiency can actually predispose someone to bleeding tendencies. Kasi kukulangin ka sa mga clotting factors, no? There is also, no, a hereditary or inherited condition, no, wherein one of the clotting factors, no, is deficient. O anong tawag doon sa hereditary condition na 'yon? It's anong tawag doon? Ah, anong tawag doon, mami? Ah, Mi, nakalimutan ko yung tawag. Ano nga itong sakit na ito? Ah, deficiency of clotting factor 8. And that is, anyway, wait lang. Wait. Let me search it. I forgot the name. Deficiency of clotting factor 8. Yeah. Clotting factor 8 is hemophilia. Yeah. Hemophilia. Anyway, so among patients with hemophilia, no, oh, they have high risk of bleeding tendencies because of deficiencies of specific clotting factors. Okay, so these are the steps followed, no, or the steps in clot formation. No? So, oh, as I have said earlier, it is usually triggered by injury, no, to the blood vessel. That is why, as you can see, the first step, injury to a blood vessel causes inactive clotting factors to become activated due to exposed connective tissue or release of, ayan, tandaan nyo yan, thromboplastin. Oh, okay? Next is yung prothrombinase, which is a clotting factor, is formed and acts upon prothrombin. Prothrombin is switched to its active form, which is thrombin, while thrombin activates fibrinogen into its active form, which is called fibrin. And it is fibrin that we have mentioned earlier. Oh, siya ngayon yung magtatrap, no, ng blood cells and fluids, which results to blood clot. So, in short, no, yung steps in the formation of blood clot, no, is a cascading events. When you say cascading, no, one step triggers, no, the other step or the next step, while the next step triggers, no, the occurrence of the next step in order for fibrin to be formed. So saan nagsimula yung cascading event? Doon sa injury to the blood vessel, which is which causes the release of thromboplastin, no? And then yung prothrombinase, no, is formed, which acts upon prothrombin. Yung prothrombin naman is switched to its active form called thrombin. Yung thrombin activates fibrinogen para maging fibrin. Ang kailangan kasi natin dyan, yung fibrin, siya kasi yung magtatrap ng mga uh, ng blood, no, and cells in order to form it into a clot. Okay? So basically, this is what I'm telling you about, no, yung cascade, no, na tinatawag. So as you can see, ano yung pinakamahalaga or yung pinaka last step? Fibrin, no, production. Oh, yun kasi yung magfo-form ng clot. And what would be the triggering factor, no, is yung injury to the blood vessels. Okay? So these are the steps involved in blood clotting. Okay? Now, no? So sometimes, ayan, no? uh, clots, no, need to be controlled so they do not spend or spread throughout the body. Okay? Kaya especially no for those who are prone no to clot formation no. Hindi kasi pwedeng uh, excessive no ang blood clotting. Lalo na kung ang pasyente no mai-immobilize, for example those who will undergo major surgery no o kaya yung mga nagkaroon ng spinal cord injury. Kapag kasi ang body natin hindi gumagalaw, there is this increased tendency of our blood no na mag-clot, mas madaling mag-clot ang dugo natin kapag hindi gumagalaw ang katawan natin. Kaya after a major surgery, for example, orthopedic surgery, wherein the patient will be immobilized, o kaya after a spinal cord injury wherein the patient is already paralyzed, in order to prevent excessive clotting, they are given anticoagulants. An example of anticoagulants are heparin and some antithrombin. No? So therefore, yan ang mga ibinibigay sa pasyente para hindi sila magkaroon ng excessive clot formation. Kasi if there is excessive clot formation, ang tendency, magbabara ngayon yung mga normal na blood vessels natin. Kasi nga, madaling mamuo yung dugo, madali siyang mag-blood clot. It can result to stroke, no? It can result to thrombosis. That is why it should be prevented using anticoagulants. Okay? Now, so let us go to blood grouping. And I think this is the last part no, of my discussion. So, there are times no, wherein patients no, will need blood transfusion. No? May mga times naman talaga sa hospital na may mga pasyente needs to be transfused no, with blood. Okay? Now, syempre, no, in terms of blood transfusion, it is very important no, that the patients or the recipient, meaning yung tatanggap ng blood, no, is matched with the blood type of the donor, meaning yung isasalin na dugo. Because, no, if the donor's blood does not match the recipient blood, there will be what we call a transfusion reaction or yung tinatawag nating agglutination, which is the blood cells no will undergo clumping, which is actually bad no. Pagka nagkaroon ng blood clumping babara din yan sa mga blood vessels no, which is actually bad and it is a life-threatening condition. No? So therefore, in blood grouping or in blood typing, no, there are two primary components that are considered: the antigens and the antibodies. No? The antigens are those molecules present on the surface of our red blood cells, while the antibodies are the proteins in the plasma that bind to specific antigens. It is actually the antibodies no, that react or that bind with the antigens. No? So, and in terms of blood grouping or blood typing, okay, it is actually the antigens that are present in the erythrocytes no, that are used to identify the blood type. No, yung antigens ang tinitingnan para ma-determine no, yung blood type ng isang tao. In the ABO blood grouping system, there are two types of antigen that may appear on the surface of your red blood cell. Ano yun? Ito. Okay? So take a look at this illustration. No? In the ABO grouping, if you will look at this illustration, in the ABO grouping, okay, let us take for example or let us consider na kunyari ang antigen A, no, ang shape niya ay spherical. Kunyari ang antigen B, ang shape niya ay conical. So therefore, if you have antigen A on the surface of your red blood cell, then your blood type is type A. If you have antigen B on the surface of your red blood cell, then your blood type is type B. And if you have both antigens on the surface of your red blood cells, then your blood type is type AB. Now, if you do not have any antigen on the surface of your red blood cells, walang antigen A, walang antigen B, then your blood type is type O. Again, it is the presence of the antigens that determines your blood type. Antigen A, type A ang blood mo. Pag antigen B, type B yung blood mo. Pag antigens A and B, then you are type AB. If you do not have any antigens, then it's type O. Now, we also said earlier that in the plasma, there are corresponding antibodies present. No, okay. Oh, in the plasma of a type A blood, okay, na-determine na natin yung blood type. Alam mo na yung mga blood type. Now, in a type A blood, sa kanyang plasma, you will find an antibody. Ang tawag dun sa antibody na yon, anti-B antibody. An anti-B antibody, no, reacts with antigen B. Ibig sabihin, galit siya sa antigen B. Kaya nga anti-B, antibody. No? Galit siya sa antigen B. It will react only with antigen B. Okay. Samantalang, if your blood type is type B, meron ka naman sa plasma mo na anti-A antibody. So therefore, it will react only, galit naman siya sa antigen A. That is why, no? A person with type A blood cannot be transfused with a type B blood. Obviously, because, kung makikita mo, if you are type A, what do you have or what antigen do you have on the surface of your red blood cell? Antigen A. Pag sinalinan ka ng type B blood, yung anti-A antibody na nasa type B blood will react with antigen A. Magkakaroon ng agglutination or blood clumping yan, which will be detrimental and life-threatening for the recipient. Same as, baliktarin naman natin ang situation. If type B yung recipient, if the recipient is type B, sasalinan siya ng type A, the same will happen because the anti-B antibody present on the plasma of a type A blood will react with the antigen B present on the surface of the red blood cell of the recipient. There will also be agglutination, which is also life-threatening for the recipient. Now, if you have both antigens A and B, katulad sa type AB, sabi nga natin, kung titingnan mo naman ng plasma niya, it has no antibodies at all. No? Wala siyang antibodies at all. That is why, no, yung type AB daw, no, is considered to be the universal recipient. No? It's universal recipient kasi, no, it can actually receive, no, blood, no, from any blood type. Kasi nga wala siyang antigen, wala siyang antibodies, no? But you have to remember, no? You have to remember, pag sinalinan niya ng type A, pag sinalinan ng type A, take a look at the cross-matching. When the type A, no, blood, no, is transfused to a type AB blood, you have to remember, no? Yung antigen, yung type A blood has anti-B antibody. Yung yung type AB, meron naman din siyang antigen B on the surface. So therefore, there will still be agglutination. Kung ang isinalin mo naman yung type B, ganun din. The anti-A antibody will attack the antigen A that is present in type AB. So therefore, there will also be agglutination. No? So therefore, ha, uh, it only dictates, no, that when we are talking about whole blood, meaning when you say whole blood, no, that includes the cells, no, and the plasma. Okay, we follow specifically the blood type of the person. If the blood type is type A, then it should be transfused only with type A. If it's type AB, then type AB only. Now, yung universal recipient, no, will be followed only if, no, what will be transfused is only packed red blood cells. No, if it is only the cells will be transfused minus the plasma, minus the plasma. If it is only the cells that will be transfused, there will be no reaction because your recipient does not have any antibodies in the plasma. Same as in your type O blood. Since the type O blood has no antigens on its surface, it is thought to be, no, a universal donor. Sabi nila universal donor because it can be transfused, no, to type AB, type B, and type A. But you have to remember that your type O blood possess both antibodies on its surface. So therefore, when it is transfused to type AB, yung kanyang antibodies will react with antigens A and B. Pagka isinalin mo naman siya with antigen B, yung kanyang anti-B antibody will react with antigen B of type B blood. Pag sinalin mo naman siya with type A blood, yung kanyang anti-A antibody will react to the antigen A of a type A blood. So therefore, no, it is followed only, again, the universal donor principle is followed only when only packed RBC will be transfused, not including the plasma, because in the plasma, that is where you will find the antibodies. Okay? No? So, if it is whole blood that will be transfused, meaning the cells plus the plasma, then you strictly follow the blood type. If the recipient is type A, the donor is also type A, and so on and so forth. Okay? So this is the agglutination reaction that I'm telling you about. No? So therefore, no? Kung type A ang donor, ay kung tama, no? Kung type A ang donor at doon sa type A na recipient, walang mangyayaring agglutination reaction because in a type A recipient, no, ang kanyang antibodies is anti-B. Hindi naman magkakaroon ng reaction ang anti-B antibody as against the antigen A. So therefore, it is safe. Same as in kapag ka naman ang blood type ng donor is type A, tapos ang blood type ng recipient is type B, sigurado magkakaroon ng agglutination reaction because the recipient has an anti-A antibody. So therefore, there will be agglutination reaction, which is life-threatening again for the recipient. because there is blood clumping. Ha? So, uulitin ko, yung universal donor and universal recipients can be used only if packed red blood cells will be transfused, not full blood. Okay? Now, the second blood grouping is called the RH blood grouping. In RH blood grouping, it's either positive or negative lang yan. Kaya merong RH positive, may RH negative. Like for example, in my case, my blood type is type A positive, meaning under the ABO grouping, I am type A. No? While under RH grouping, I am RH positive, kaya A positive. No? Meaning, RH positive, no? Meaning you have RH antigen, or sometimes it's called antigen B as in delta, no? So if you have antigen D as in delta, no, in your red blood cells, then you are RH positive. And 95, no, or 85 to 95% of the population are RH positive. Karamihan sa atin RH positive, no? So RA so walang antibodies na involved dito, no? Hindi katulad sa ABO grouping. Kapag ka type A ka, then you have anti-B antibodies. Pag type B ka, then you have anti-A antibodies. Di ba? So dito, walang antibodies na involved, no? Yung mga RH positive, no? Kahit RH positive ka pa, you do not have antibodies. Kahit RH negative ka, you do not have antibodies also. Antibodies develop only, no, if an RH negative person, kung yung RH negative is exposed, no, to an RH blood by transfusion or from mother to fetus. Paano nangyayari yun? Ayan, no? If the mother is Rh negative, for example, and the fetus is Rh positive, kasi di ba sabi natin, no, 85 to 95% of the population is Rh positive. Nagkataon, yung nanay Rh negative, yung fetus Rh positive. Paano pong nangyari yun? Pwedeng maging Rh positive ang fetus if, no, yung father is Rh positive. Okay? Di ba? No. So, ang nangyayari, syempre, Rh negative, nag-asawa ng Rh positive, yung nabuong fetus is Rh positive. How can the mother be exposed to that Rh positive blood? If the fetal blood leaks through the placenta and mixes with the mother's blood. Okay? So, during delivery, yan, no? During delivery, the mother's blood produces antibodies ngayon against that Rh. Kasi na-expose na siya sa Rh positive blood. Okay? So, ano mangyayari? So, as ang resulta, oh, oh, after manganak nung nanay, nakapag-produce na siya ngayon ng antibodies against Rh antigen. Di ba? So, can the fetus be affected? Can the fetus, no? Can still be affected? No. Kasi naipanganak na yung fetus, nakalabas na siya. Kasi the exposure takes place during delivery. Now, if the succeeding pregnancy, halimbawa nagbuntis ulit yung nanay, ang ipinagbubuntis niya, Rh positive pa rin. Yung second fetus na yon will now be affected because the mother already have antibodies against Rh positive blood. Di kawawa yung fetus. No? Kasi yung antibodies nung nanay aatakihin yung kanyang blood. Kaya yung kanyang red blood cells, no, madaling mag-undergo ng hemolysis, no. Kaya ang tawag doon, it's the hemolytic disease of the newborn. Okay. So, ito yung mga na-mention natin kanina, no? O, na-mention na natin yung CBC, no? Oh, and you already know the normal values, no, for CBC, no? Nakita dun sa figure kanina. Complete blood count, no? So, RBC count, hemoglobin, no? Hematocrit, and white blood cell count. Oh, hematocrit is the percent of blood volume composed of RBC. Oh, di ba? No? Kaya it is expressed in percentage. Sometimes it is expressed in decimal, no? Okay? So, yung hemoglobin naman, it determines the amount of hemoglobin, no? Kasi yan yung nag-i-indicate ng anemia. Okay? Ayan. So, ito yung ginawa niyong blood typing, no, in the laboratory. So, you already know, no, your blood type, no. And by looking at it, no, kung may agglutination reaction. Okay. Okay na to. Prothrombin time, white blood cell. Yan. Ito yung white blood cell differential count. Nandun din yan sa figure kanina. And we said that the most numerous are the neutrophils. Pinakakonti naman yung basophils. Okay? Leukopenia is the term that is used when there is low white blood cell count, while leukocytosis is the term that is used for uh, high or excessive white blood cell count. Okay? Yeah. So that ends our discussion for blood.